Good morning. This is Dr. Bill Wyatt again with American Orthodontic Society, and I want to talk to you this morning about high-angle cases. Just had some thoughts on that I thought I ought to pass on. I've covered this case before, but it's about an impacted second bicuspid. I'll show that as we go. But what I'm concerned about today is high-angle cases, and we used to encourage people that were just getting started in orthodontics to stay away from the high-angle cases. If you can get a high-angle case, and if you have a closed dental bite with a high-angle case and you try to open the bite up again, that if you don't know what you're doing there, you're going to increase the vertical height of the face. And now, if you wonder what I'm talking about, let's get this young lady up and I'll show you. This is just too much vertical dimension of the lower third of the face in here. In other words, if her chin came out to say something like this, I mean, it'd be a much nicer, maybe give her a little bit more facial structure than normal. Now, if you have somebody with a high angle situation, they look much better if you get them while they're smiling. Now, there was a movie star that used to act, and she always had her mouth open and was smiling, but when she closed to, it looked bad. And so that's just something you can cover up the high angle if you have one. All right, let's go. Now you see when she smiles, but she shows a lot of gum tissue in the smile. So you have to watch that if you have this. Don't smile with your lips up this way. Just kind of do the Cary Grant smile, just kind of a little bit of a smile like that, but don't do way up like that. That kind of covers up this gum tissue right up here. You don't want that to show. These are just ways of getting by with it if you do have a high angle case. All right, I'm going to show what we did in here. There are several things you can do to keep the bite from becoming, the jaws from becoming too far apart in here. Like if you extract teeth on somebody, I mean, you take some of their teeth out, then you've got the same jaw pressure on fewer teeth. You'll tend to lower the vertical dimension of the face. I mean, that's just putting muscle activity over here on fewer teeth that you've reduced in here. So this is one thing we're going to do here is do this. Then you can correct function. Like if you've got somebody who's a mouth breather and they tend to swallow with an infantile swallow pattern. It's hard for an adult to do that, but you can swallow without biting your teeth together. And if you do that, you're going to develop a high angle case. Sooner or later, it will do that. You can, now to swallow that way, you've got to do your tongue a certain way. And I doubt if people watching this can swallow without biting your teeth together. If you do bite together, you've got a certain amount of force from the upper and the lower teeth, and that is where your vertical height to your face is established. Upper teeth are erupting down, and lower teeth are erupting up. If you take out these teeth here on the side, the bottom teeth will rise up. If you take these out on the bottom, let me erase that. If you take these teeth on the bottom out and leave it alone a while, these will erupt down, and these continue. Now, the vertical height of the face in here is where these two forces come together and they establish a point in here. And this is set up when you're just a child. And if you change that, you've still got the muscle force out here. It'll tend to go back to that. Now, they used to think that as people got older, their teeth wore down in here. So they would put a stainless steel cover over all the teeth out here, and you wore that, and after about a couple of years, the teeth would depress that much. In other words, the muscles had the say-so. They would depress your teeth. So maybe on high-angle cases we could do that. But then you come up on this on high-angle cases, most of them have a slight pressure here. They don't chew like some people do. Some people, the muscles are stronger and they're out here in front. In a high angle case, they may be further back and they don't bite together like that. Now that part of it you might inherit, but most of the high angle cases come about by lack of proper function. And if you get somebody breathing properly and swallowing properly, you press your teeth together like I've never counted anybody swallowing that, but you can put a deal on people, and they tell me that people swallow somewhere around 2,000 times a day. I mean, that's day and night, of course, and that's a lot of times to. If you want to count the how many times you swallow, you can see. But in normal situations, when you bite to swallow, you will press to with a certain amount of force. Even if you just press to with a pound or so. I mean, 2,000 times that. I mean, it's 2,000 pounds. Those teeth have resisted during a 24-hour period, and that is where your vertical height of this face comes to. And you can mess with it much as long as you've got that same bunch of teeth or the teeth meeting in here. So in this high angle case, we're going to try to take out some teeth, and then that'll put what load she's got on fewer teeth. Hopefully over a period of time it will go down. We had very little reduction in the height of this face, but I used one thing wrong that I'll show you as we get to it. All right, we've got a fairly deep dental bite here, and we're going to try to open this bite by pushing down on the lower front teeth and raising up on the upper front teeth. More of it was down on these teeth. So we're going to use these intruding wires that go down here, and we raise them up, and they're pulling the teeth down. Now, as that wire pulls these down, it pushes this up with exactly the same amount of force. I mean, but if the person is chewing properly, if they're biting down here good, that has very little effect on it. But if you take a person who's not chewing properly, or they just don't put any pressure on this, then these teeth will erupt, these will come up, and if you have intruding wire up here, these will go down, and you'll increase the height of the face by whatever these teeth come together over here. Now, I don't want to get this too complicated and everything, and I feel like that probably I've got these videos and everything are just more complicated than most people like to mess with, and so that's one reason they don't really take to these too good. Okay, let's go ahead with the case, and here we decide that we're going to take out teeth. Now, if you take out, I didn't want to bring the face back too much, but you can go back and take the second bicuspids out, and I took the deciduous molar here, and then the permanent bicuspids, and we also took out the wisdom teeth on the case. Now that's 8 teeth that we've taken out, but the wisdom teeth had not erupted into the mouth at that time. And same thing on this side. We took out the 8s or the wisdom teeth back here, and then everything in that gap right there. Now I didn't do that. I sent her to a old surgeon or somebody who got them out. And also she had that impacted lower bicuspid down there. And it's a real odd thing that I need to show you a little bit, but I've got a whole video of that. You can pick that up in the same person. All right, the lower teeth have got some crowding, and so when we eliminate this is the second deciduous molar. We're going to have plenty of space in here. We'll bring these teeth back into that space and, of course, bring these up to the front. And I wanted to stress another thought in orthodontics that I don't think I've talked about much. If you take a tooth, say a bicuspid or something like this, and you move that tooth, it doesn't matter if you push it this direction, the tooth tends to exfoliate some as it moves in that direction. If you push it over here, it comes up in this direction. If you turn it around, twist it, it comes up as you do that. That tooth, in every movement you can put on that tooth, it tends to exfoliate to some extent, except if you get right on top of it and push down on it, then you can intrude the tooth and push it down into the structure here, and it'll move down. Now we're going to get over these teeth and try to intrude them. In other words, we're going to go down into the bone structure, but we'll work off of the 6-year molars back here where they take a lot of force, and we'll have a wire that goes way down low, and we raise it up and hook it to these teeth, and it'll bring them down and also flares them forward a little bit to give you some room. When you get them out where you want to, you tie, and you have another Archwire in there, and you tie it back. You'll have a little omega on that wire, something like that, and you run a wire around here or back here, and you come up and tie that back. But this wire cannot move out any, and now as you go down with them, they'll go thin. You'll reduce the amount of flaring. Like you'll just take them down more or less like that to open the bite. Now, this gets a little more, I don't want to, I'm lecturing to people that probably many of you don't do very much orthodontics, and some of you have done an awful lot, so you won't need to know some of these things. Okay, here we're going to extract those teeth, and let me erase out my drawings here, and we go in. Now here I want to show this bicuspid, though we've got a whole video on that. You see this bicuspid right here, it's got a tremendous amount of decay, and it's all eaten out on the inside. And somebody thought they was doing a pulpotomy and gotten the disease out of it and all that, and they put a crown on that tooth. Now, if you're a pediatric dentist or you're a dentist and you snap these little stainless steel crowns on those teeth and you don't have that thing really done, a root canal done on it properly, and it's hard to do, then you're going to have a force in here. Now this one doesn't look like an abscess or anything, but this will push down on this developing tooth right here. Now, this was done in 7 of 79, I believe. Yeah, that's the date I've got on it here, the first x-ray. And I saw that thing, I thought, oh my Lord. And so we got after it pretty quick on that. And they had the high going and all that. So we're planning to take all these teeth out anyway, right through here. So we're going to remove them. And then we'll take the wisdom teeth that haven't deformed yet back here out on the case. All right, now watch this right here when we change pictures now. No, I think we jump. All right, here is the next picture that I took. In other words, I was just seeing this person every once in a while. That's 2 of 85 here. And the other picture that we had where it was setting up in there was 7 of 79. And we didn't see that person for 6 years. And when we did, that tooth was like that. Now, they had been seeing persons, dentists, and somebody crowned that tooth like that. And some way or another, it doesn't look like an abscess, but it developed a cyst or pressure that pushed this tooth down right on the cortical bone. And this tooth was not there to start with 6 years back. Now let me go back here to, let me see. All right, here we are in 79, and here it is in 85. It's about 6 years difference in there that I didn't take another Panorex, or I sent them to their regular dentist, and they weren't doing anything like that. So now we've got to go after it, and we're going to have to take these out, and that's not going to be a fun thing to do, and these, and these. We're reducing the teeth so that we can get the vertical height of the face down. Now, so this trying to reduce the height of the face in people is very difficult. You put a hypo headgear, you do it all you can, and you can't do a lot. So one, they'll come in, and I've scrubbed in on where they were high angle, and they took the whole maxilla loose and clipped 8 millimeters off of the sinuses and everything and pulled it up, and that reduced the whole height of the face. I mean, the facial height of the lower third of the face. Okay, here we go, and we'll go through this pretty quick. This is 816, and we're closing that space up and everything, and lining the teeth up. And now here are 2 x-rays I've got. Just here this was in 79, I think, and here it is in 85. That's just blown up. And that formed an either, I don't think it was an abscess, but I think it formed some kind of cyst and pushed this tooth down like that. And so we had to get that whole thing out of there. Okay, here we've taken the case and we band it up and do all this. Now I made another mistake in doing this. This was back in 86, and I wasn't really up on intruding arches then, but if you're going to push down on these teeth, it's going to push up on these, on this molar tooth that you've got that intruding archwire. See, you see the two archwires. This archwire here on the outside comes way down like this, and it comes up over here, and you raise it up and hook it to these teeth, and it'll open just during anything. I mean, it'll open it. Now, the person, if they chew good, even if you don't have a block in here, it won't open as much. But if you put a block, bonded block in this area, it'll chew, you'll mash down on that block, and you can intrude these teeth and not raise this vertical dimension one bit. And this is not for the beginners to get on high angle cases like that, but it is a fact. If you put these bonded blocks in there, it'll actually depress the molar teeth while you're pushing down on this, and it's pushing up on this and down here. If you got these blocks in there, these teeth won't move a bit, or they'll actually be depressed, depending on how much chewing and how hard that person chews on the teeth. So these are some of my thoughts on high angle cases. And so if you're in there and you're doing everything that comes in the office and you do your high angle cases, take the things that we've said here. You need to know how to do every one of them. It's very difficult to lower this. But if you get a person who is functioning wrong, in other words, they aren't biting their teeth together when they swallow and they're breathing through the mouth, or they're sucking on something that keeps their mouth apart and their teeth are glued together, you know how to stop all of that stuff and work with it and get them chewing and functioning right. Over a period of time, they will get some relief from that. All right, we can line the teeth up. It doesn't matter on that. And we'll run through the orthodontic, just regular orthodontics here. We brought the upper teeth forward a bit by, you see, changing that archwire, going up like that. And you see we put a little more of an angle in them and bringing this forward to get this out in front. And we're almost finished on the lower. And here we have finished. We've got the upper and the lower. And we put a bite plate on the retainer with a deep bite case. Always put something, add to the retainer. It's even better if you go in and bond all these teeth together and then put your retainer on top of that, just a thin layer, so that the lower teeth come to that point and they can't, they come here and they can't go back up here. See, and it keeps it there, even if they lose a retainer. If you've got a bonded one there, it'll work. It won't open the bite further and mess up the retainer. All right, let's go a little further here. Now here's when you started, and you're smiling with that, and here it is. Then this is a high angle case. Now, if you have that, if you'll smile, but don't smile real monster smile where you pull the gum tissue like that. So you don't want to do that. So teach the people how to smile and how to chew and everything else, and you help their appearance. Now that smile is good on there, and it kind of masks the fact that you've got more length in here than you really would like to have. But if you close it, it doesn't work that way. Now that's that smile. But even with that type of smile, when you close the teeth together, it looks like you got too much space in here, and you do. But you can mask it by, now see how that looks too much in there. But let me run back here to this, and it looks better. So anyway, it's very difficult to lower the vertical height of the face. And I'm going to finish up here and close and say thank you for watching. And if you're doing a lot of orthodontics and you're taking your high-angle cases, you really should look into all of these things that we're talking about, ways of reducing it other than surgery. And then surgery is I've scrubbed in on them and I've seen it. And you want to stay away from that if you possibly can. And so try to do these things that you can lower the vertical height of the face. I have some surgical cases in here that if you go through all these videos, you can see the cases on it. So just try to prevent it and do these things that we're talking about and get the person breathing through their nose. That's the main thing to do.